Friday evening, the 22nd of October. Some fairly interesting news today, actually, largely from the United States and the UK and a little bit from Russia. But let's start off with some orientation, because there's some definite trends developing here. Now, here we see the new daily confirmed cases. Now, if we look at this, we see that Canada, are pretty certain, is going down slightly, but a downward trajectory. Australia, pretty well levelled off, and we noted that Australia has actually done very well recently. The vaccinations are going up. Now, there's a definite European trend here. So we've got Germany cases up dramatically, Netherlands cases up dramatically, and Ireland cases up dramatically as well. This downward line here is the United States. So the downward trajectory in the United States is being maintained, although there is a proviso that we'll look at in a minute. Now, the United Kingdom is just about off the scale here. I mean, we are absolutely way up. A dramatic increase in cases in the United Kingdom. Now, this is new daily confirmed COVID tests. So we see that part of the reason that the UK has got so many cases is because we're testing a lot. So the United States is under testing and Canada is under testing as well, certainly compared to the United Kingdom, quite dramatically so, in fact. So that does cast a little bit of doubt on those figures from Canada and the United States. They're probably higher than that indicates. But getting back to this grouping we're looking at now, this is the one line here. The R value is 1. Let's just zoom in and have a look at that. So remember that this is the R value of 1 just here. So we see that according to this data in Canada and the United States, the cases are falling. But as we know, they're not testing that much. Australia level just over 1. Germany well over 1. Ireland well over 1. United Kingdom well over 1. And Netherlands, we see they're increasing quite dramatically, and that line there is 1.2. So we see Germany, Netherlands, for example, is at about 1.3 at the moment, and the UK just under 1.2 according to this Our World in Data. So remember, that's 1, 1.2, 1.4. So definite trend for increasing cases in those parts of the world. Now, number of patients in hospital, the United States is going down nicely, so that's good. The United Kingdom is going up in terms of hospitalisation, as is Ireland, Canada fairly flat, and Netherlands fairly flat. So United States going down, not dramatically down, but certainly going down, in the UK going up, and Ireland, and we haven't got data here from Netherlands and Germany, but it'd be reasonable to assume that that's going up somewhat as well, as we've seen cases going up so dramatically. Deaths per million, well, this really is quite a sobering slide. I mean, the deaths in the United States are still really quite high. Now, this is the hangover, if you like, from the previous high number of cases. So I would expect these to go down, I would hope, in the next few weeks. But at the moment, they're still really quite high in the States. So let's just look at them. So Netherlands down there at the bottom, which is fine. Australia, well, it's still individuals, of course. Germany, Canada, Ireland has increased. United Kingdom, well, the trend there is more or less up, really, isn't it? But the United States, in terms of per capita, the deaths are remaining really pretty high in the United States, unfortunately. So that's just a few orientation slides to start us off. Now, I want to start off by looking at the United States, who've come up with new ideas on vaccine boosters. So let's just dive straight into that now. So pick and mix and match in the United States now has been confirmed. Now, to be fair, we have been saying this on this channel for some time. For months I've been saying I suspect that you can combine vaccines, but of course that was based on very incomplete data. This from the FDA and CDC is based on very complete data indeed. So it's pretty definitive, and this is what they're saying. Moderna, Johnson & Johnson can now be boosted. They can now have their boosters. A month after the Pfizer ones, it has to be said, but they're there now. Dr. Walensky, choose any 3 boosters, now authorised, regardless of the original shot. So basically you can have anything now, regardless of your original shot. So This makes it good because it means people have got plenty of choice. They can choose by their personal preference. And it also means that the logistics are a lot easier. So, if anyone can have anything, that kind of makes it a bit easier. There might be a proviso on that, as we'll see in a minute. The evidence shows that all 3 COVID-19 vaccines authorised in the United States are safe. Direct quote from Rochelle Walensky, but I don't like this. Safe is too all-embracing a term. Safe to me means it's safe, whereas we know there's a relative amount of risk. We know it's small, but we know that risk is there. So to say they're safe, if you said they're safer than getting the disease, I would 100% agree with that. But to say they're safe seems a bit of an overstatement to me. As demonstrated by the over 400 million vaccine doses already given, which of course has been a major success. And they are all highly effective in reducing risk of severe disease, correct, hospitalisations and death. These things are true, even in the midst of widely circulating Delta variant, which we have learned over the last month or two with relief. Now, FDA did not recommend any particular combination of vaccine boosters, so to switch or to stick. So this is a pretty big question mark right now. Now, this new booster thing, that you can have any booster, that started today. And the CDC is still working out if they're going to recommend particular boosters for particular people in particular circumstances. So we don't know that yet. Now, to be fair, I'm being a bit over cynical here because we are expecting the CDC to pronounce on this probably in the next week, I would say. I'd be surprised if they haven't done it by next Friday, hopefully earlier than that. So it is coming out, but it hasn't quite come out yet. What we've got at the moment is advisory panel member, a paediatrician from Ohio State University. I agree that those who received the Johnson & Johnson vaccine should receive a second dose, yes, because we know that the coverage from the Janssen Johnson & Johnson is not as good as 2 shots of the Pfizer or Moderna. But I would prefer that those individuals get an mRNA vaccine, he says. Now, okay, that's his opinion, so we'll give it a tick. Don't know why, we don't get a rationale for that. So that's kind of a bit of a leak on what's coming. Will they say something like, well, if you've had a Janssen Johnson & Johnson, you should have a half dose of the Moderna or a full dose of the Pfizer? Probably. Will they say if you're a young man, you might be better not to get the Moderna? Don't know. Will they say if you're a young woman, you're probably better not to get a booster dose of Janssen Johnson & Johnson? We don't know these things. It might be going by the side effect and the risk profile. So we know that they're all good at preventing death and hospitalisations and severe illness, and with a booster that will be even more so. So I think it may well be the recommendations that are coming out from the CDC, hopefully next week, may well be that those that minimise the likelihood of side effects or adverse reactions to the vaccine. So FDA has authorised a 3rd shot of Moderna or Pfizer-BioNTech. So, yep, we know that. That authorised the Pfizer a while back, of course. But this applies to anyone over the age of 65 at the moment, or any adults with severe risk due to underlying conditions, job exposure or institutional settings. So we can envisage people in care establishments, possibly prisons, people that work in healthcare sector, possibly people that work in retail sector, because as we've said many times, retail workers have been the unsung heroes and heroines of this pandemic. They've just kept going, selling us groceries that we need to survive all the way through. And they have been at high risk. There's no question about it. Do be complimentary to your grocery provider next time you go, because they've done a good job. As long as it's at least 6 months for the second dose for the Pfizer or Moderna. Johnson & Johnson recipients, it's anyone 18 or over, they're currently saying at the moment, providing it's been at least 2 months since getting the last shot. So obviously we see that this one is 2 months. The mRNA vaccines are 6 months because the vaccine protection is waning and is less with the Janssen Johnson & Johnson, unfortunately. So they want the boosters to roll out quicker. In the fully vaccinated, 105 million people in the States have had Pfizer, 70 million Moderna, the series, and 15 million people the single shot. And more than 11 million people have been boosted so far. So that's news on that. More from that on the CDC next week. It will be interesting to see which way they go as regards to the recommendations that they are making. Now, the United Kingdom, well, let's just look at the cases on the COVID symptom tracker data. I mean, wow, it looks just right up, isn't it? So in terms of symptomatic cases, it's actually higher than the peak. It's certainly as high as the peak. So 22nd of October, over 1,075,000 people symptomatic. Back here it was, what was it? Yeah, slightly higher than the previous peak last January. It has to be noted there already, and this is probably going to carry on going up because our R value, as we've seen, is about 1.2. 84,000 new cases, and as we've said there, over 1 million people currently symptomatic. Now, this is the people symptomatic, of course, so the actual prevalence of the disease will be higher. And likewise, when we look at the daily summaries from the UK, well, people testing positive up 18% on the week, deaths up 15% on the week, 947 people died within 28 days of a positive test. Patients admitted to hospital also up over that 1,000 a day mark, which is not good. Over the 1,000 a day mark is not good. Let's hope this isn't sustained for long. But that's where it is at the moment. Quick look at the trend in cases in the UK. And, again, very, very similar to the COVID symptom tracker data, which is good to have that collaborated. And healthcare, as we've seen, also sadly more patients in hospital. Slight uptick in recent days. So that's the trend in the UK. Big gap, of course, between cases and hospitalisations. I mean, this was nothing like the hospitalisations it was before. And we're going to look at data that, information reports that says it's probably not going to go that way. It's probably going to be much less this winter in terms of hospitalisations. Now, I don't know if I've got the CMO slides here. So the Chief Medical Officer's slides come out on this, so you can click on that too. Oh, we can get to them, that's great. So these are a number of people testing positive. So we see that upward trajectory as of a couple of days ago, we know that. Number of people in hospital, again, we see the slight upward trajectory, nothing new there. Deaths, again, we see the slight upward trajectory. Deaths continue to tick inevitably upwards. Number of people have been vaccinated, so both doses of the vaccine were on basically, by now it's probably 50 million people, and both doses of the vaccine, what is it? It tells you there, 45.4 million have also received a second dose. So vaccination, but do look, the shape of that line there is only going up gradually. So there's still this runt of people, this remnant of people who have not been vaccinated at all in the UK. So that line is flattening out, as indeed it has done in quite a few, in the United States, for example, and other countries. Number of people who've received a booster vaccine, 4 million have received a third dose already in the UK. That's for the boosters. Now, this is a particularly interesting slide. COVID-19 cases coming into emergency care within 28 days of a positive test. Now, these are the people that have had 2 vaccine doses, and these are the people that are unvaccinated. Now, bear in mind, about 80% of the population have had 2 vaccines. So this line here is taken out of 80% of the population, whereas this line here is taken out of 20% of the population. So we see that the unvaccinated are massively disproportionately represented in people that are hospitalised. But we also see that people are being hospitalised after being fully vaccinated. The risk is not eliminated. The risk is greatly reduced, but it's not eliminated. But do bear that in mind. In rough terms, that sample there for the fully vaccinated is 20% of the population. That's 80% of the population. So we see that the unvaccinated are greatly overrepresented. But what we also see is even in people that are doubly vaccinated, we do see that the risk of hospitalisation increases with age, as we've also always seen, and it's also increasing with comorbidities as well. So that's quite important to show that, really, that the risks of the risks in people that have been doubly vaccinated do go up with the recognised risk factors that we've always known about. If you're into stats, there's some interesting extra bits and bobs that they show there. But I think that's quite a revealing graphic, actually. That one from the from the COBA, from the Chief Medical Officer's recommendation. So that's that there. Now Sajid Javid was talking a couple of days ago. He said we can expect 100,000 cases this winter. The question is, to what degree will this transpose into hospitalisations? And as fortune would have it, Scientific Advisory Group for Emergencies has published just today on this very topic. But we'll just go through what they've said systematically. Now, they say there is a risk posed by further viral evolution, unfortunately, and that could become dominant globally as a very real possibility. So they're saying there is a possibility of another alpha/delta variant type takeover. This could be a completely new variant, or it could be a subvariant, as we looked at the Delta variant plus a couple of days ago. So they're saying that the risk of mutation is still there, that they are saying that this virus, in their opinion, still has the potential to mutate, to become more transmissible. They don't comment specifically if they think it could become more pathogenic, making people iller. I would have thought if it becomes more transmissible, it's probably not going to make people iller as well. So I'm moderately optimistic on the likelihood of really nasty new mutations coming on. But this is SAGE, and they say it's a very real possibility that there'll be another bad variant. Therefore, which we agree with, capacity to monitor for variants, yes. The genomic testing, which is good in the UK, highest number of tests in the world carried out in the UK. Denmark with the highest proportion of coverage at 100%. United States still pretty poor, really, when it comes to genomic sequencing of the virus and looking at that allows you to trace the phylogenetic history of particular mutations. Conduct predictive vaccinology. Now, we have been promised a more specific vaccine for the Delta variant or for other variants, but so far we haven't got them. So it looks like they're going to consider new variants and then think about modifying the vaccine, the vaccinology, to be more efficacious against the new variant. But so far that's not happened. So why we're still on the original vaccines that we had right at the start of the vaccination program, I'm not really sure. That the more specific vaccines that were talked about and we are assured are relatively straightforward to produce simply haven't arrived. So that is a bit of a mystery, that one. Why is that the case? I don't pretend to have an answer. It's 4 question marks. Wintering into 2022, this is SAGE again. Hospital admissions above the levels seen in January 2021 are increasingly unlikely. So here is what we have. So this is the January. This is January 2021. That was the peak there. And they're saying that these are unlikely to go as high again. Well, I should hope not. Let's hope they go nowhere near that, because the link has been largely broken. So hospitalisations may go up a bit, but SAGE are saying that this is very unlikely to happen, at least getting to these kind of levels up here where we were in January 2021. So that's good. So that they seem confident about that. The uncertainties are around behavioural change. People are tending to behave pretty well as normal now. And the other question mark is waning immunity. To what degree is that going to occur? So they're the big variables. When we had this release of restrictions on the 19th of July, was it in the UK? Cases could have shot up then because we didn't know how people were going to behave. That's the thing that was hard to predict. But immediately after the legal restrictions were lifted, people carried on as if they were. It's kind of the momentum of social restrictions, mask wearing, hand hygiene, all those things kind of carried on. Whereas now it's falling off quite significantly. So that is going to result in more cases. But the SAGE believe it's not going to result in hospitalisation levels the same as last year. And this is their full report here. Quite accessible language, it has to be said. They do a summary there. Nothing too hard to understand if you're prepared to sit down. It's not a casual read, but if you're prepared to sit down and read it seriously, The average lay reader could make sense of that, and the details are there in the SAGE report. I'm going to come back to this one in a minute, because that's an important point, the co-infection. So co-circulation and co-infection of SARS coronavirus 2 with respiratory syncytial virus, another respiratory virus, and influenza. This is a risk that we don't want. Now, way back in the winter of 2019-2020, when there was quite a lot of influenza around then, and we had a few people who had COVID-19 at the same time as influenza, and they got really quite sick. So given that people's immunity to flu has reduced, there is a risk that we'll have a bad influenza season combined with the remnant of the COVID-19 pandemic, or at least what I hope is the remnant of it in the UK and the States anyway, and Europe. And that means that inevitably some people will get both infections at the same time, and that could make them really quite ill. So that is a concern, and that is why the flu vaccination programme and the COVID vaccination programme are both so important. We need to be covered against both. And people who have symptoms of any respiratory infection should stay at home, according to SAGE, because it's not only the COVID, it's the COVID in combination with the RSV and the influenza that could be really quite dangerous, double whammy this winter. Now, briefly, Russia, things are not good at all. Over 1,000 deaths a day, and we know that these are underreported. We've been into that before. Volgograd, which of course was Stalingrad, famous in the Second World War, which of course before that was St. Petersburg. 26% of people vaccinated, not unvaccinated. Only 26% of people, and actually that says patients. It should say people in Volgograd vaccinated. Very low uptake. In hospital number 1, COVID patients 750. 700 of them are unvaccinated. Only 26% of the population vaccinated. The scale of new infections and deaths has alarmed authorities so much that, and Russia, of course, has been very reluctant to take action, but all workplaces shut down for a week from the start of November, kind of a fire break they seem to be going for there. That's a massive step for President Putin to take. Massive step, and that's been resisted so far in Russia. So this tells me that the authorities in Russia are seriously concerned, and with good justification. Moscow closing non-essential services from 11 days from next Thursday. So 6 days' time. 11 days, Moscow's going to be pretty quiet. Very, very low vaccine uptake. Why is the very low vaccine uptake? Years of scepticism about the authorities is one reason. People simply do not trust the authorities. Anti-vaxxers, social media, very active. And the other thing is that Russia introduced the vaccine before they'd done the clinical trials, and people just didn't want to do it without the clinical trials, which of course is completely understandable. Now, yesterday we got a lot of feedback from Kyle about Kyle's video, which he very bravely, nobly really shared with us. So do catch up on that yesterday. Lots of feedback on that. Now, Daniel has sent us a video, or given us permission to use his video, from Australia. Bit of a similar experience, really. And Daniel wanted to show you this to give you the important message that after vaccine, Daniel, and indeed I think it's probably best not to do any serious working out and take it easy for a good few days. And if you do get any symptoms of complications at all, then certainly rest until a senior doctor tells you otherwise. But anyway, over to Daniel in his own words, which is, and there'll be a real sting in the tail at the end of this. I'm not going to tell you it now, but there's a really important point I'll be making at the end as well. So over to Daniel. Thank you very much, Daniel, for allowing us to share this at your time of suffering.
Hey everybody, how you all doing? Just wanted to do this video. As you can see, I'm obviously in hospital. I'm going to be kind of quick. I think the nurses are coming in. But long story short, 2 days ago, I was training, just doing a shoulder workout as you do normally. I thought pulled a muscle. End up going to bed that night, woke up in a lot of pain. As I woke up, my partner next to me also said she was in quite a bit of pain from her chest. So I thought, okay, that doesn't sound good. Now, knowing she actually just got a second Pfizer jab 3 days ago, I've done a bit of research. I'm like, this probably isn't normal. So took her and drove in to hospital. We sat there. I thought, we'll kill two birds with one stone. I'll get my shoulder looked at. She can have a checkup. We proceeded to go through. She went in one room, I went in the other. Doctors came up to me. One of the first questions they asked was, have you been vaccinated? And I said, yes. I've only had one Pfizer shot, and it was about nearly 3 weeks ago. And they said, okay, did you notice any side effects? Any chest pain? I said, yeah, little bit of pain here, but I think it's just from my shoulder. And they go, any heart flutters, blah, blah, blah. And I said, yeah. I noticed within a few days of receiving the vaccine, I was getting mildly short of breath. Didn't think too much about it. Still training hard twice a day, most days. Anyway, they had a cardiologist come up, cover me in these probes for an ECG, come back, said I had an irregular heartbeat and rhythm. They proceeded to take me through to another room where they pumped me full of something, and they put me in a machine and checked everything. And they then informed me I developed pericarditis, which is a bit of a shock, considering I only had one vaccine. Then dealing with the cardiologist, she's also informed me I've got some scarring of the heart, and they've directly linked it to the vaccine. Also, my partner has developed myocarditis. We're both fit, we both train a lot, so it's very shocking. And honestly, I just want every young guy out there to know, like, if you are training and you're getting vaccinated, stop training. Because I was due for my second, and the cardiologist said it could have killed me. It's only by chance I'm here. So, yeah, good luck to everybody, and do your research.
Yeah, it's really distressing, isn't it, actually? So that was after Daniel's first jab, 3 weeks after the first jab. His partner, it was after the second vaccine. And again, exactly in the same as we saw with Carl yesterday, we're talking about very fit young men here. And because they're in a pattern of going out training, the thing is, if your heart goes, if you get some inflammation in the heart, then that can cause an area of electrical instability. And if you go training when you've got myocarditis, for example, if you go training, you've got this area of electrical instability in the heart. And what can happen is that area of electrical instability can become unstable and start giving off lots and lots of impulses. So lots and lots of impulses, it becomes electrically unstable, and the heart muscle tries to follow that electrical stimulus. So instead of having one stimulus coming from the top of your heart going down to give you a nice regular contraction, if you've got this area of this area of what we call ectopic focus and electrical instability, that can be giving off 200 little impulses a second, and the heart can't respond to that, so the heart just ends up doing that. And that is called fibrillation. If it's in the bottom chambers, that's called ventricular fibrillation. And of course, that will, if you're not immediately treated, you'll die within minutes, become unconscious within about 10-20 seconds. So that was a risk, and it was only because his partner had pain that he decided to get checked out. So two things there. Daniel recommends not training if you've had the vaccine. At least, and I would say certainly don't work out hard if you've had any indication at all that you might have a cardiac complication. Absolutely rest and get immediate medical attention. Now, I also emailed Daniel because Kyle yesterday said that just after he got vaccinated, he developed a metallic taste in his mouth that lasted for a few hours. That indicates to me, because we did ask Kyle further questions and he didn't have an allergic reaction from the answers he gave me. So to me, that indicates that if it got from his arm to his mouth in 10 seconds, it was in a blood vessel, because they're not aspirating these injections. So I asked Daniel the same question, and I haven't got his permission to share this, but I'm sure he won't mind. because he's given us full permission to share the video and his links. So, John, funny you should say that. Yes, I did. The glands in my neck went instantly inflamed and then reduced within seconds again. So he got this feeling in his neck within, what did he say, instantly. So presumably within seconds of getting the vaccine. So again, if the vaccine's gone from Daniel's arm to Daniel's neck instantly, to me, the only way it gets there that quickly, if it wasn't an allergic reaction, and again, there's no indication that it was, is if the vaccine is inadvertently given into a blood vessel. We need to change the way of giving vaccines. So you stick it in and you pull back to make sure you're not in a vessel and only then inject it. That's what we need to be doing. So thank you, Daniel. Really appreciate that. It really is. I personally find it really quite moving that people share their suffering with me and give me their permission to share it with you so other people can be helped. So thank you very much, Daniel, and thank you very much, Carl, yesterday, and thank